Good afternoon, everyone. My name is Hannah Gehring. I'm the Communications Manager and Public Information Officer for the Lake County Health Department in Lake County, Illinois. And with me today, I have Melissa Adamson with the McHenry County Department of Health and Executive Director Mark Pfister from the Lake County Health Department. Thanks for joining us today for our discussion.
Thank you.
Thank you.
All right. We look forward to answering questions on Facebook Live today. So if you do have questions, feel free to chat them in at any time. We'll try to get to as many of them as we can. Really what has brought us here today is that we are talking about this new North Suburban Region 9, which makes up Lake and McHenry counties. So I want to start out and ask Mark, would you mind sharing with our viewers today what the North Suburban Region 9 is all about?
Absolutely, Hannah. And I just want to say to those out there listening today, we just so much appreciate you and what you've done through the last 6 months. Your efforts have really made us successful over that time frame, and we really did an excellent job in our positivity rates in both McHenry and Lake County, dropped below 3%. So we really thank you for everything that you did, staying at home, washing your hands, wearing masks, and social distancing. So first, I just wanted to say that. And all of you remember is that we were in what was known as the Northeast region. And so that was made up of many, many other counties, including Cook and Chicago, DuPage, Kane, et cetera. And so now what the governor has done has divided the state from 4 regions into 11 regions. And so what Region 9 is the new North Suburban region, and that is the 2 counties, McHenry and Lake County. So that is our new region. And I just want to say it's been an absolute pleasure working with the officials from McHenry County. And so we really decided that we're going to absolutely collaborate in any way we can to reduce the COVID-19 impact to both of our counties.
Great, thanks, Mark. So, Melissa, could you maybe shed light for our viewers on what metrics are being tracked as North Suburban Region 9? What are we looking at as we're working together towards a common goal?
Sure. So there's a couple of metrics that the state has set. They basically are those early signs that we may be seeing a resurgence. And they're as follows. So a sustained 8% positivity rate for 3 consecutive days, or some of the following: sustained increase in the 7-day rolling average. So that's 7 out of 10 days in positivity rates, and a simultaneous decrease in hospital capacity. So that's medical, surgical, and ICU bed capacity under 20%, or sustained 7-day rolling average increase in hospital admissions for COVID-19 like illness.
And what is our current standing when it comes to these metrics?
Well, actually, we're moving in the wrong direction. So as I said earlier, we were able to get down to 3%. But as of today, what is out posted on the website from IDPH that any of you can go to is that right now we're at 5.1% for the region. And some good news is some of the other metrics that Melissa just talked about is that we're at 39% for what is known as the med-surg beds, and then we're at 54% for ICU beds. So the targets for those 2 are 20%, and then the target for the positivity rate again is 8%.
Okay, so our positivity rate has been going up over the last several weeks as a region. Let's talk about why this is. Melissa, could you share maybe what you're seeing in McHenry County?
Sure. So basically, since the start of phase 4, that was at the end of June, we started seeing some increases among younger groups and populations. And we can attribute some of that, when we look at our data from contact tracing and where we're seeing some of the trends in transmission. People are gathering in larger groups now than they were in phase 3. We're seeing associations with bars and restaurants, and in some cases, youth sports, and as people, again, are gathering in these larger groups.
And is that the same in Lake County, Mark, or are there other things that we're seeing?
Yeah, so that's pretty much tracking the same way in Lake County. So it's great that the two counties are together in the same region. So we are seeing an increase, especially in the under 30 individuals in Lake County. So ages 30 and under is where we're seeing the greatest increase in COVID-19 positive cases. A lot of those are happening at private gatherings, at sports events. We're also seeing some changes in daycares. We are looking at some other recreational facilities like country clubs, where we're seeing some increases. We've been getting a number of complaints at bars in particular, where people are not social distancing or masking. And then, of course, we really increased the amount of testing in Lake County at our long-term care facilities. So we are still picking up some cases, especially in staff in our long-term care facilities. So they're not, at least we're identifying it, so they're not exposing residents at long-term care facilities.
Got it. What age groups in our counties are seeing the greatest increases, and do we know why?
So again, I think what Mark just said, we are seeing it in McHenry County in our younger populations, where we didn't see that initially when the pandemic started. So even the 0 to 9, the 10 to 19, and the 20 to 29-year-olds. And for the previous reasons that we outlined, people are moving about more, they're going out more, they're beginning to gather more in larger groups. They're going out, trying to enjoy some entertainment, but may not be social distancing or wearing masks, which is the recommendations.
Okay.
Yeah, and same thing.
Thank you, Dad. Mark?
Yeah, same thing in Lake County, and anybody can go out to our data hub on our Lake County and see that the greatest proportion of cases are really in that 20 to 29 year group. But as Melissa said, it's just, having that social interaction, not masking, and also doing it indoors. And so we do know for a fact that, indoor congregate settings is where we see the COVID-19 virus pass much easier than outdoors with social distancing.
Okay, so I want to talk a little bit more about the Region 9, just so that our residents, if anyone has questions, again, feel free to chat those in. But this is new, this Region 9 working together, Lake and McHenry counties. And there's been talk about mitigation measures. So those metrics that you talked about, Melissa, if we cross those thresholds, we may have to implement mitigation measures. What type of mitigation measures might we be looking at in Region 9, given what we're seeing in cases in our county?
Okay, so the state's outlined a number of mitigation strategies by setting. It's not an exhaustive list, right? So we have various intervention options using a tiered approach that as a region we can select. So it allows us to sort of tailor those strategies that best suit our situation and what we're seeing from the data. So just as an example, we've said bars and restaurants a couple of times, just as an example. So if we start to see those rates go up past the targets, right, we might want to look at reducing indoor dining capacity as a possible option, and reduce other indoor capacity for say organized recreational activities like in gyms or fitness centers or sports centers. Those are just a couple of examples. So there's a lot of options to choose from. I think we would try to start with the least restrictive options to see if we could bring those rates down before we would go into more restrictive mitigation strategies.
Yeah, and Mark, could you maybe shed light on how we would determine and kind of how that process would go to get those mitigation measures in place?
Yeah, so what we do is, and I'm, thankful for Melissa mentioning that, we're going to use data. So, both entities are very data driven. We're going to be using our contact tracing data. We're going to be looking at all the sources of information, complaints, et cetera, to try and figure out, where we can actually mitigate or reduce the spread of COVID-19. And so what we're going to be doing is Melissa and I will be in direct contact. We'll be talking about potential interventions that may be successful. We'll bring in the Illinois Department of Public Health and get concurrence from them as to the direction that we're going to go, because ultimately IDPH has the authority under the executive order, and then we have other mechanisms, regulatory mechanisms that we could actually utilize to try and impact those mitigation strategies.
Okay, so I'm looking at some of the questions that we're getting on Facebook right now, and we do have a lot of questions about businesses that are coming in, and this is really common. Can you talk about what your health departments have been doing lately for business-related complaints, and maybe help guide our residents on what they can do if they're aware of businesses that aren't following the safety precautions? Mark, can you start?
Yeah, I'll go ahead and start. The number one thing is every day we're responding to various complaints across the county with regard to all types of businesses, not just food and bars, also other businesses, nail salons, manufacturing plants. And so we handle those complaints very seriously. And so we will be contacting them either by phone, or there's times that we actually go out and look at their situation. Are they allowing for physical distancing? Are their staff, wait staff as an example, wearing masks? And so we're documenting all of that. And so just in the last 2 months, we've had over 300 complaints that are just food and businesses only. And so that is something that we want to make sure that we're addressing in a timely manner. And so how we're doing that is that we attempt to work with the owner and the manager. And so the majority of the time we get voluntary compliance, so they change the seating arrangements, that they don't allow as much standing near the bar, that they will get their staff to wear masks, and then make sure that there's more appropriate social distancing within their facility. So most of the time we get voluntary compliance. So when you reach out to us, we do investigate all of these complaints that come in. And then, from a regulatory perspective, there's a couple different methods that we have, some tools in our toolbox to be able to do that. One, if it's such a large imminent health hazard, we have the ability, for example, to suspend somebody's food permit or permit that they may have from us. Another way that we're testing this is by issuing a ticket, either a warning ticket and then a violation ticket. And that's where our administrative adjudication process, where they'll come in and they'll sit in front of our hearing officer, and then that hearing officer will determine what type of fine that they may levy against that business, depending on the evidence that we provide. And then the third method that we're working with our liquor commissioners locally, who are generally the mayors of the municipalities or our county board chair, is that, what could be done if it's a establishment that has a liquor license, what type of warnings, what types of fines, or potential revocation if people are not following the order.
So, Melissa, what would you say to a resident who wants to get in touch with someone because they're concerned about what's happening at a business that they either visit or they hear about, some unsafe things? What would you direct them to do?
So, they certainly can reach out directly to us, by sending, we have an email account that's right on our website. It's just a general health mailbox that's monitored. People can send complaints to us that way. They come in various ways. Some people email us directly, or they even, make phone calls to us to alert us to a situation. So those complaints come in various ways. I think we've even seen some complaints posted on our social media. And we try to follow up, just like Lake County, on many of those. Our process may look a little different, not a lot, but we do try to get that voluntary compliance that Mark referenced, and we try to approach it as an educational opportunity, right? To ensure that everybody understands the process, what they're supposed to be doing to help ensure that we're keeping residents and patrons safe. That's what this is about, is to minimize the transmission and utilize those universal precautions that we have available to us, like the masking, the distancing, et cetera, to educate business owners about how we can, continue to keep our businesses up and running and keep the economy going by taking these small steps.
Mark, do you have anything else to add? Any other recommendations for people?
Yeah, actually, I think another couple of recommendations just for what they can do is that, if you're out at a restaurant and your wait staff is coming towards you, and they're wearing their mask, then you should put your mask on just to minimize any transmission between you and that wait staff. And then I think you can also talk to a manager. You can say to an owner, I mean, you can just say, hey, it looks like it's pretty crowded in here. Your wait staff are not wearing masks. We really recommend that you do that because we would appreciate to have as safe as uh, conditions as possible.
All right. Looking through the comments here, there's a few comments specifically and questions about the younger people getting COVID-19. So are younger residents who get sick with COVID-19 showing symptoms? Katie submitted this question. Are they showing symptoms? Are they getting severely sick from COVID-19?
So I can take that one. Is that a lot of and I think that's one thing about youth is that the younger you are, the greater your potential to have a better immune response to COVID-19. So, many of the young people is that they recover quicker, and they also have situations where they may have symptoms, but some young people don't really. They ignore those symptoms. So they may have a sore throat, they may have a cough, they may think it's something else, and so they're not getting tested for COVID-19. So we are finding that there are youth that have symptoms. They may not necessarily do anything about those symptoms, but then one thing with the youth, their immune response is better. So we're seeing far fewer hospitalizations, and many youth do not have the same underlying conditions that people over 60 do.
So we had a question from Tony. She says, is it safe to bring my children to the playground? Knowing that young people can get and spread COVID-19, is it safe to bring my children to the playground? Her kids are 1 and 3, and her 1-year-old can't wear a mask. Melissa, do you have any thoughts on that?
Yeah, I mean, correct me if I'm wrong, Mark, but I think in phase 4, playgrounds are still closed. Am I wrong about that?
Yeah, I mean, there are playgrounds that are open, and so the playgrounds that are out there, I do know that some park districts they're trying and attempting to try and get them wiped down and make sure that they're clean. But I think anybody that goes to any park or any playground is that they should make sure that their children are having their hands consistently washed. And if you can't wash their hands, then you bring hand sanitizer. And then, the other thing is just trying to keep them social distance from other kids.
Okay, great. Let's see. Back to business-related questions. Debbie has asked, does an employer have to notify if someone you work with closely tests positive for COVID-19?
Could you repeat that?
Yes. So does an employer have to notify one of their employees if they work closely with someone who has tested positive for COVID-19?
So, through contact tracing, right, when we identify close contacts, in some cases, we are notifying the employer who has the knowledge of where other staff people have been within their workplace.
Well, this also gets into HIPAA violations. So, I mean, one thing is the employer is not to necessarily, it doesn't have to share the name of the individuals. And in fact, the employer should ask, the individual if they want their name shared. However, that employer is providing lists to us as health departments of who were potential contacts with that individual. And then the health department reaches out to those individuals, and we don't give the name either of who they may have been in contact with, but we do say that you may have been in contact with a case. And so then we talk to you about who you've been in contact with, and then also recommend things to you about quarantine, as well as potentially getting tested.
And are employees that get COVID-19 and they have to miss work for that, do you know if there are protections under the law where businesses are required to pay for sick leave for their employees during this time?
Yeah, there's no law that requires payment or the provision of sick leave. Certainly, what we have been asking different corporations is that, to attempt to make sure that people that were that need to be quarantined, that they just work with their staff to assure that, if they have to quarantine, that they have a job when they get back, and if they do have the ability to provide sick leave, we certainly would recommend that.
Okay. All right, we've been getting a lot of questions in the inbox in Lake County, I know specifically about travel, because it's vacation season. People are, wanting to go and take some time off of work. What are your recommendations for travel right now? Melissa, do you want to kind of share what your thoughts are on that?
Yeah, so I think we in this county don't have any travel restrictions per se, but we certainly want everyone to be aware of where they're traveling and where there might be hot spots across the United States. And in some, there are counties in our state that do have some travel restrictions for anybody who's traveling out, into some of those hot spots and have quarantine in place. So I think, again, these are sort of those things that we can all do our part to be aware of where we're going, and that there's a risk that we could get exposed to the virus and then bring it back to our home state, our home county, and transmit it to others. So again, that's back to all those universal, the 3 W's, the wearing our masks, the washing our hands, the watching our distance, and being mindful about where we're going and what might be happening in that state or in that area.
Yeah, in Lake County, Mark, a few weeks ago, we have been pushing out a list of states that you should consider a self-quarantine for, but that's changed recently. Could you maybe shed some light on that?
Yeah, I think, as our counties actually move closer to where those other quarantine states are. So, our incidence rates are getting very similar to what those other states are. So not only just travel outside of this county, but travel inside our counties, is that we want to make sure that, if you don't have to travel, it's not essential, then stay home, relax, and just stay well. So I think, that's our message is if you don't have to travel, it's not essential, then please don't. We're still in a situation where as a nation, we're still grappling with the COVID-19 increases throughout the state. And then, as you know, when you travel, you tend to loosen up a little bit and maybe do things that you may not do when you're at home. So, I think the 3 W's, if you're not following the 3 W's, if you do travel, then you might want to quarantine when you come back.
And would either one of you be able to explain what quarantining means? Because I think there tends to be a little bit of confusion on what a self-quarantine even looks like.
Mark,
yes.
I either way, do you want to start?
Sure. Let me talk about isolation. So I think this is, I'll start with isolation. You can end with quarantine. So we usually talk about 2 different words, isolation and quarantine. And so isolation is for cases. So when we talk about that, somebody that has COVID-19, and so that individual, we're isolating them until they're no longer infectious. And so now, by the time we know somebody's positive, that they need to be isolated for at least 10 days and then not have a fever for at least 24 hours. So then that's the case, that's the individual. And so then I'll let Melissa talk about the cases that come in contact with people and what we do with contacts.
Right, so Mark mentioned the cases. So quarantine is for people who have come into contact with a case, a known confirmed case. And quarantine is based on, it's a 14-day period based on the date of the last contact with the infectious case. So sometimes somebody could be in isolation, and if you imagine a household, so there could be a case there, and then you have everyone else in the house potentially quarantined. who are not exhibiting symptoms and haven't tested positive.
So that 14-day period is why, if you're coming from a place where you haven't taken precautions, you may have been exposed. That's why you're coming home and potentially doing a self-quarantine.
Correct.
Correct.
For that 14 days. Okay. We've got a number of comments here related to schools, and I know that's a hot topic right now with everyone getting ready for this school year, which is, of course, going to look very different this year given the circumstances. Let's see. So, I mean, one question that we have is, you know, why is the governor not just closing down all the schools given the situation with numbers rising in Illinois?
Well, I don't want to speak for the governor, but I can say speak for myself, and Melissa can speak for herself, is that one of the recommendations that we've made to the Lake County superintendents is that all of them are planning for at least a hybrid model. And so for those of you that may not know what a hybrid model is, it's a combination of potentially in-person as well as remote learning. And so we want them to have that preparation completed, is so that if we need to move, if we do have students in the school, there is an outbreak, you know, then we are already prepared for remote learning. Now, I can say in Lake County is that the majority of the school districts have already made a decision that they are going to go to remote learning only. So, you know, frankly, for Lake County, as the governor doesn't necessarily even have to do that, many of the superintendents and school boards have already made that decision. And then they're looking out until, you know, October, you know, our conditions going to change or potentially allow students to come back into classrooms.
And in McHenry County, it's very similar, where many districts had started with a hybrid plan, have since decided to go fully remote, at least initially through October. And I think they're going to assess the situation by then. And we've been supporting the schools, you know, providing technical guidance and helping interpret the recommendations from the state as they develop their plans.
And one of the things, too, Hannah, that we're going to be doing with our Northern Illinois Public Health Consortium is that to assist the schools in making some data-driven decisions, we're actually working on creation of some risk models, you know, for both reopening the schools or closing the schools. And so that's something that we're hoping to have done and present to superintendents, not this week, but next week with just some of the work that we're going to be doing over the next several days.
Yeah, so to kind of go right along those lines, we had a comment from Katie asking if schools are allowed to open in this phase, are they staying closed or opening based on high levels of infection rates? Could you shed light on kind of some of the data points that school districts are going to be looking at?
Yeah, so what we've done already here in Lake County is we provided all our school districts with some baseline, you know, zip code level data. We're going to be providing them with for positivity rates. So we've given them point prevalence rates as well as positivity rates by zip code. And then we're wanting to have a dashboard that parents, teachers, as well as administrators can see across our county, you know, that have that dashboard so people can see where we're at, you know, at the zip code level. Because what you're seeing on the IDPH website or even on our websites is, you know, you can get some zip code level data and you can see, you know, what's happening in the county level. But we want to make sure that there's more up-to-date data, you know, for our parents, our teachers, as well as our superintendents so that they can see that risk-based information. And then we'll put it into a type of model that, you know, will show that here's some certain triggers. If you start moving to 8% as an example for this metric, you know, then we may want to do this. If you move to a incidence rate of X, then you may want to do this. So those are all types of things that we want to give them some risk models so that they can make decisions, and certainly so the parents know what's coming up as well as the teachers.
Do you have anything to add to that, Melissa?
I don't. I mean, I think those are great ideas where, you know, we haven't taken some of the steps that Lake County has, but I think those are great ideas that we can look at seeing whether or not we can implement those here in McHenry County.
Melissa, do you have any advice for parents as they're preparing? Because I know a lot of people are worried going into the fall. Do you have advice for parents, as they're preparing for the school year?
It's a big question. I mean, again, familiarize yourself with your district's plan, right? All the districts have plans. They're getting posted. I believe some who had started with a hybrid and are pivoting to a remote model may be in the process of updating those plans, but they post those plans on their website. So I think it's a good idea for all parents to familiarize themselves with those plans. There are requirements in there for masking, right? So obviously if kids are home remote, that's gonna look a little different, but I think the target will be, or the goal is going to be, to try to get kids back in school potentially later in the fall, right? So, do parents have masks available for their kids? Are they, practicing those new habits with children, washing the hands, helping them understand what that social distancing looks like? And that school is going to look a little different than it does currently. I think those are a couple of steps that parents could at least start with in terms of familiarizing themselves with what's happening in the school. And certainly, be willing to ask questions about like what happens to their kid if they're in a classroom with a child who tests positive, right? Some of those things are still being worked out in those plans. And school districts are sharing that as that information becomes available.
Yeah, so really being aware of what the plans are in your children's school districts and getting those questions answered to help you kind of prepare mentally and be ready for the school year. Mark, do you have anything to add to that?
Yeah, and I just want to say that I've been very impressed with all our superintendents in Lake County. I mean, they are taking this extremely seriously. They're asking tremendous questions. And I got to say, there's been some very innovative solutions that they've come up with. One, for example, is that at least there's one or more school districts now, is that they're going to bring their teachers back. They're going to do all remote learning, but then their teachers are actually going to be in the classroom. And so let's say you're a chemistry teacher, you can be showing the students doing the experiments. The students are at home watching, the experiments. So there's going to be kind of a combination of remote learning, but with some real good didactic training. So I have to say that I've been very impressed with our superintendents and administrations on, thinking innovatively and really attempting to assure a safe situation.
Right. We had a question early on in the discussion from Pat, who has a granddaughter going back to school, and he's wondering, for someone who has compromised health, like a grandparent, is it safe for them to bring their granddaughter, grandson into their home to visit with them if the child is attending school in person?
Well, I'll answer that question. Is that, I think anytime that you have, anybody over the age of 60, you just need to be much more careful about your interactions with, anybody. And so I think that's where, while we love to hug our grandkids, I don't have anything, but I love to hug my daughter. But I think this is where, there's certain types of things that those interactions, we just have to do the elbow bumps or, try and minimize that contact and then just stay social distance. I mean, if the child can wear a mask, have them wear a mask. And frankly, have those interactions outdoors, because we do know that outdoor interactions tend to be lower risk than indoor interactions.
Melissa, do you have any other advice for people that might be high-risk individuals during this time?
Yeah, again, I think, so that question was specific to schools, but, keep in mind that we all have personal responsibility to keep ourselves safe, and I believe also to keep others safe. So again, it goes back to those 3 W's. But, if you go into a business or somewhere and you notice that they're not following the guidelines, take the opportunity to walk out, if that makes you more comfortable, right? So I think people should be empowered not to have to stay in a situation that makes them uncomfortable or that may put them at risk of being exposed to the virus.
Mm-hmm.
and wash hands frequently. And that goes for, so if you're seeing your granddaughter, make sure that mom has given that child wash their hands or give them hand sanitizer. I mean, we just want to make sure, because people touch their faces and kids touch their faces all the time. And so that we know that's how the virus is getting into the nasal passages into the mouth.
Mm-hmm. Still on the subject of school, we have a lot of parents that are getting ready to send their students back to college, and students may be living in apartments or dorms. Lexi says her 20-year-old is going to college and has 4 roommates in 1 bathroom. What advice would you give, other than the basic masks and social distancing? What do you do when you're living with other individuals like that in a college setting?
I'm not sure how to answer that. I mean, I'm assuming we don't have that. I mean, we have community colleges here, but they're not dorm situations. So again, I think to the extent that students understand how to protect themselves, I'm assuming that universities also have plans and some protocols in place to minimize the risk, among their student population. I am aware of some colleges that are requiring people to test in advance of coming into school. But there are some limitations with testing, right? So that's good, but there could still be risks. I think it's a tough question, Mark.
Well, I mean, definitely, especially if I know a lot of colleges have gone to residential halls where they have separate suites, that they have sleeping quarters that are different. And I think that's where, I mean, any student should be talking to their roommates and just making sure that they don't have any symptoms. And if somebody does have symptoms, that they stay in their room. I think the bigger thing is that between, showers and use of the bathroom, is that they have some type of product that can, actually disinfect, between different individuals. So just trying to disinfect, between each use in the bathrooms. I know it's hard. College students are not I was one once. They're not the cleanest people on earth. And so they have a lot of things to do, but I think that's just something to get into a habit of making sure that you're disinfecting between, different people, and then just self-quarantining, in the room, or if they can.
Okay. Randy just asked, how quickly do you see schools and districts getting point-of-care tests available to them, so those rapid tests for schools? Are either of you aware of that being an option in either of our counties?
Yeah, unfortunately, it's not going to come anytime soon, and it's probably going to be too late as we move forward. Those point-of-care tests, some of them require that you actually have to have a certified lab to run those tests. And then some of the other point-of-care tests, that the sensitivity or accuracy of them is not so great. And so, depending, like, for example, there's antigen tests out there. So you're not testing directly for the virus, but you're testing for proteins of the virus. So if you get a positive test, it's usually relatively accurate, and you can trust that positive test. The problem is that if it's a negative test, it's not as accurate. And so usually you have to have that confirmed by, a PCR test that's more accurate for that. So unfortunately, there's just not a lot of units out there yet. And so I know, like UIC, for example, they developed a saliva test. They're going to be using that. So some colleges that actually have a research arm, have developed their own tests and have that testing. But the majority of colleges are probably not going to have that point-of-care test, and certainly not the K through 8 or high school districts.
Do you have anything else to add, Melissa?
No, I thought Mark's suggestions were great.
So I think there's still a lot of questions that residents have about testing. So maybe we could just talk about kind of the current status of testing, because there's a lot of things, different types of tests that people are curious about. What are your health department's recommendations when to get tested and what to do if you feel like you need to get tested? We'll start with you, Mark.
Yeah, so our recommendation certainly is that if people have any symptoms or believe they've been in contact with somebody in the last 5 to 7 days, and really that's something that we want to stress, is that just because you've been in contact with somebody that may have been a case, we do want you to delay your testing for a little bit, because you may been in contact, but you haven't had enough time to build up the amount of genomic material that would give you a positive test, that you may show up as a negative. So we're telling people, if they have been exposed to somebody that was positive, that they wait 5 to 7 days from that exposure to be tested. But we do recommend that they get tested. Testing is open to everybody. I do know McHenry doesn't have the same opportunities that Lake does. You're welcome to come to our county, or come to any other county though, to get tested at some of the community-based testing sites. It's free. And generally you get your results back within 4 to 7 days. But certainly if you're a contact of somebody that was positive, we want you to get tested. And if you have symptoms that appear to be related to COVID-19, loss of taste of smell, diarrhea, that you're having coughing or you're having a headache, go get tested. So we want more people to get tested than not.
How about in McHenry County, Melissa?
Yeah, so, I don't have a lot to add. Mark pointed out we don't have any state testing sites here, but, we do have federally qualified health center. We have, people should contact their provider to try to get testing. We have on our site links to where people can find out about where they can go get tested. And I encourage everybody to go there and, find a testing site that is as close as possible. But if you do have a primary care provider, a relationship with a medical provider already, I would encourage people to start there.
Yeah, and Melissa, I'm going to second that. And certainly if you're having, major symptoms or problems, if you're having shortness of breath, we actually want you to go to the emergency room. Yes. If you're having, troubles. And certainly we want you to go to your primary care physician if you're having, major symptoms or any symptoms, because they can test you. But then the difference between the community-based testing centers, you don't get any advice after you get the result of your test. And so that's what your primary care physician would offer, is additional advice as to what the result of your test was.
Right, and I think it's just a really great point that you bring up, Melissa. In working with your healthcare provider, you want to keep in touch with them, even if you get tested at a community-based site, or get tested at an urgent care clinic or something. It's great to stay in touch with your healthcare provider to make sure that they're aware of kind of where you're at with your health, because that's an important part of that relationship. Where are we at with a COVID-19 vaccine? Mark, what do you think about our status right now?
Well, yeah, the good news is that there does appear to be several vaccines that are looking promising. So I want to say that first and foremost, so that we have some optimism that there are some potential candidates. They are in the third phase of their testing. So we do know that the federal government has already started purchasing some of these vaccines to get out ahead of this, so that even if the vaccines don't work, unfortunately, that is tax dollars that will not go the right direction. But if they do work, then at least we'll be prepared to start vaccinating people. And so what's happening right now is that there's determinations that are being made as to who would be vaccinated first, because obviously there's not going to be hundreds of millions of doses ready to go to vaccinate, all Americans through the United States. So what they're looking at first is who would get these first rounds of vaccines. And then, then when there's more vaccine availability, is then we would probably start, as well as McHenry County is doing mass vaccination clinics, working with other providers, other health systems to push those vaccines out as quickly as we could. But I don't foresee, just based on what Dr. Fauci was saying, is I don't foresee us having vaccines in any large quantities to start doing that until, the spring of 2021. So that's still a ways out. And even if we do start getting vaccines in the spring of 2021, based on our experience during H1N1, it does take a while to get fully ramped up and get a larger supply. And there's still a lot of questions that are unknown. We don't know what the vaccine, if it's going to be a one-shot series or it's going to be a two-shot series, because that will also complicate matters. If it's a two-shot series, we don't know if they're coming in pre-filled syringes We don't know if the storage of the vaccine. So still a lot of questions that are out there, but I'm optimistic that we may have a vaccine in 2021.
So we still have some time to go before we've got the COVID-19 vaccine. But as we all know, the fall is approaching, so we're heading into flu season. Melissa, how important is it for people to be considering the flu shot this year?
They definitely, the recommendations are everybody would still, we'd recommend that everybody get a flu shot. So as you can imagine, we're going to have both COVID and flu happening. It may be confusing for people, right? Whether or not they have flu or COVID. So getting your shot is going to help provide some protection. And then certainly kind of back to some of the things we've already said, if you're having symptoms, we would encourage people to reach out to their providers. But we definitely want people to get their flu shot this year, no question.
Absolutely.
And we had a question from Lexi. She asked if, are you going to offer outdoor flu shots or like maybe a drive-through type flu shot setting? Is that in the cards, or are you aware of any places getting ready to do that?
Well, I know we're in McHenry County, we're putting our plans into place about how we're going to promote flu vaccines. So I would say stay tuned.
Yeah, and I know in Lake County, we're definitely preparing, and actually we're going to do some test runs because we know that we're not going to be doing the same methodology of vaccinations like we did for H1N1 because we don't want people standing in lines. So, we're really looking at that mobile flu shot, having lines, people getting vaccinations as they drive through. And we're actually going to test that model with flu shots. We're going to start with our Lake County employees that we're going to be doing that. Looks like we're going to be doing that mobile and test that theory and see what our throughput is by doing it that way.
Okay, we've gotten a number of questions, and Michelle and Randy have asked about data at the zip code level. I'm just wondering if each of you could share about your county's data hub and kind of what you're providing and how residents and stakeholders can get the information and the data on COVID-19 that they're looking for. Melissa?
Sure, I can start. So we do have a data dashboard on our website. So if you go to mcdh.info, you will see a COVID-19 graphic, and below that a link to the dashboard. So we have everything from confirmed cases at the zip code level, like a map tying into GIS, to how those are distributed throughout the community. For example, if it's a community acquired versus a long-term care facility. We have the demographics on race and ethnicity, by age, rates by ethnicity, on down. And then as you scroll to the bottom of our dashboard, we have additional statistics that are in alignment with the state's measures, right? So we post them for our county specifically. And we say that our data is more up to date than the state's. There is a lag there. So I would encourage everybody to check on our data from our site specific to our county. So I'm just talking about our county data, not the regional components. So we also include a hospital availability, 3-day rolling average. We're including the test positivity. So those same metrics are available on our county dashboard page.
And how about in Lake County, Mark?
Yeah, so we have our COVID-19 data hub, and so much of what Melissa said is that we have on our site, we are going to be revamping our site to enhance it by going down more to the zip code level. And so there's some other products that we're going to be putting out there soon. One nice thing is when we originally put it up there is that we're getting a lot of questions and people wanted to know about their municipalities. And so, you can click on any municipality, see how many cases are in that municipality, and then they're color coded by the prevalence, which we put it towards the population. And that's the same thing we're going to be doing for, the zip code level data. So that's something that's coming because we have heard from our public about some other things that they want. And so we're going to be providing that very shortly.
Okay, great. we're getting close to our time here. We've got about 10 minutes left. So I just want to make a quick, public service announcement to those who are watching us live on Facebook. If you still have some questions that are unanswered, feel free to comment. We might not be able to get to all of these today because we are getting a lot of great questions. But we are going to try to go through after the discussion is over and also kind of respond to, questions on the Facebook comments. I want to go along this. We were talking about optimistic. We were talking about the possibility of a vaccine. We hear a lot of bad news with the COVID-19 pandemic, and I'm wondering, what is going well? What things are positive in your mind? We'll start with you, Melissa.
Okay, so I think we've alluded to it. Yeah, it's easy to point out the things. We often hear what's not going well, but so many businesses in our county are doing a good to a great job, right? Everybody is trying. I think most everybody is trying to do the right thing, follow the guidelines to the best of their ability, right? We've asked a lot of our community, our residents, our businesses. So I think the fact that we are reopening, people are able to, do things in a modified way, and it's probably going to be that way for a while, but we really appreciate everybody trying to implement the measures that are recommended, right? So that everybody feels safe. It's good for business. It's good for the economy. A couple of other things, we are seeing the deaths are trending down overall. So that's good news. And then the recovery, we have a high recovery rate. So ours here in McHenry is about at 95%. So those are all good things.
And Mark?
Yeah, and I'm going to second. It's been 2 weeks here in Lake County where luckily we've only had one additional death. And so, that's just a tremendous change. We were having multiple deaths per day for many weeks. And so that's a tremendous change. And I really give thanks to, working with our long-term care facilities. We have a corporation that has been working with us and really helped enhance our testing of long-term care facilities. And the long-term care facilities have really stepped it up with their infection control. And so we've just really been able to minimize the new cases in those long-term care facilities that have led to death. And so, in Lake County, unfortunately, about 70% of our deaths are linked to long-term care facilities. So that's been a pretty major change and a great change because, it's certainly not good for anybody to lose a loved one, especially somebody that's a patriarch and a matriarch in a family. Some other great news is that, just as Melissa said, is that, it's thanks to you guys. We were way up. If I look back in time, our cases were growing, every day. We were up in 200 plus cases every day in Lake County. And so we got all the way down to 20 cases per day. Now, unfortunately, we've moved back up into averaging about 90 cases per day in Lake County. We do have a larger population than McHenry, so it does sound larger. But those are the types of things that we don't want it to go back to where we were. So made a lot of progress. But I also know that, there's a lot of families out there that are hurting. This has been a challenge economically. There's been a lot of people that lost their jobs. The federal government has stepped in and helped out with some assistance with like $600 checks. Hopefully the federal government can continue supplying some dollars because we know that there's other things in life that, we're very concerned about. And we know that many of you are looking after your neighbors and that, we don't have people in social isolation and that they're getting food. And so, we've seen that our communities have really stepped it up and made sure that people are getting, what they need. And I know the counties have been, county government, municipal governments, and our not-for-profits have just been tremendous about making sure that those unmet needs are being met. So lots to be thankful for, a lot of volunteers. So I just wanted to thank everybody for all their efforts.
Now, you bring up, Mark, the impact this is having on a lot of families. And we just got a question in from Katie about, mental health programs for children who have faced trauma from this situation. that's a big, even broader than just children. There's a lot of mental health impact on our counties and on our families right now. Melissa, would you share, what kind of resources there are for people in McHenry County, or any thoughts you have about the mental health impact and what's coming?
Sure. And in fact, when the pandemic first hit, we identified mental health as one of those things that was going to be really important to be on our radar all the way through the pandemic and long into the future, right? So I think we've anticipated that. I would encourage everybody, we have a great mental health board here who has been involved with the pandemic response since the beginning. So I would encourage everybody to connect with the mental health board. They work with the mental health agencies in our county. And so that would be the best way for them to connect to those resources here in McHenry.
And how about in Lake County, Mark?
Well, certainly in Lake County, we've never stopped offering different mental health services, either here at the health department or outside at, with our external partners. One of the big positives that we started recently, thanks to United Way in Lake County, is that we started up 211. So if anybody has somebody that needs mental health services, all you have to do in Lake County is dial 211. Those operators will get you to our crisis care hotline that we operate 24 hours a day, 7 days a week, 365 days a year. And so you can talk to somebody live, and then we can get you referred either to a program in the health department or a program outside for whatever that individual may need. I will say one good thing about the COVID-19 too is that we used to have a wait list for our psychiatrists here at the health department to see a psychiatrist. It may take 3 months. We're down to less than a few days, because with us being able to use telephonic and telehealth services, is that our no-show rate, with those psychiatrists has dropped off dramatically. So they're able to serve many, many more clients than in the past because we don't have people not showing up to those appointments. People are showing up to those appointments. So definitely call 211 and they'll get you hooked up with our crisis care hotline, and we can get you referred to the care that your friends or yourself need. And
Hannah, I'm just going to jump back in. McHenry County does have a crisis line as well as 211. And then there's also a McHelp app that's people can utilize for crisis situations.
Fantastic. Those are great resources. So thank you for sharing those. I want to close out. We're getting close to the end of our time here. And I just want to ask, as public health administrators, I'm sure that both of your lives have been a little chaotic over the last 6 months. So I want to talk about self-care and what's your favorite activity to do that's a safe way to decompress and kind of manage the stress of the pandemic?
I can go first. So I think chaos is a good word to use. The situation has been fluid and it's constantly changing. And so we've all had to adapt and pivot as needed. In terms of self-care, hugely important, right? And we are trying to encourage all of our staff and everyone to recognize and be aware when they have or are reaching their limits. For me, I do a variety of things, from just knitting and sometimes ripping it out, and knitting and ripping it out, to cooking is something that I enjoy and find relaxing, as well as just any little creative thing. I've been teaching myself to sew. And I also have signed up over the course of the pandemic. A lot of courses have gone online that are free. And so I signed myself up for a wellness course. It's really about the science and evidence behind wellness.
How about you, Mark?
Well, one of the great things that I have is I have an exceptional team, and Hannah's an example of that. And so, my stress levels are much lower because I have a tremendous team that helps me out day in, day out, and really does an excellent job for our Lake County residents. But I think the number one thing that I see and use is really, just being outdoors. I think, there's a lot of science behind walking outdoors, being in green spaces. And so, I'm either out there biking, running, or walking. And, so that's my moment of zen, is just getting out into the forest preserves. And Lake County's just got a tremendous amount of green space that is readily available. So And I definitely stay 6 feet away from people. And, and if I'm running by you, I guarantee you I will run way on the other side of the trail. But I think that's, but certainly I just have nothing to say. My county board's been extremely supportive, Board of Health, and my team has just been absolutely exceptional, working 7 days a week.
Yeah, I echo that too. The amount of work that people have put in, and these are in really tough times, right? So without our team, none of this would be happening. People have been really stretched and are just going the distance. So that's fantastic.
My team just sent me a message that someone is asking how I practice mindfulness during the COVID-19 pandemic. My Zen place is on my hammock in the backyard with my kids, with my toddlers crawling all over me, hugging me. So I try to steal away for those moments when I can get them in this crazy time. All right, we've come to the end of our hour. I want to give each of you the opportunity for kind of a closing comment. What is it that you really want to say to the residents in your county at this time in our region? Start with you, Mark.
Well, again, I just want to thank everybody for everything you did in the past. We just want you to continue doing that. The 3 W's, I mean, that's going to be our new motto, is that, wear a mask, watch your distance, wash your hands. And really, I think this is just so important for us until we can get a vaccine, until we can get into a place where, the virus isn't circulating like it is now. So we absolutely need your help for our success to continue to move forward. So thank you.
And Melissa, closing comment?
I thought what Mark said was great. And just, again, appreciating everybody to the best of their ability, right? To participate in this process, during this chaotic time that we're living in. If we all do a little bit of our parts to keep ourselves safe, keep others safe, it's going to go a long way to keep our rates from spiking, because we're in this for the long haul. This isn't, there's not an end in sight yet. And I know that I don't say that to be discouraging. I say that to keep some realistic parameters around it. And I know it can be hard for people. So definitely, back to, if people are struggling with mental health, we've got resources. Let's focus on how can we help each other get through this crisis, because it's going to take all of us working together, I think, in order to get through it.
And then Hannah, I think just one last thing too is that, we're talked a lot about school, but, I just want to say to the parents, we absolutely need your assistance too, is that, if there is a case of COVID-19, we really need you to provide us with who your kids have been in contact with, so that we can make sure that we're stopping that infection sooner than later. And then again, it's just so important for, families to make sure that their kids are not going to these social gatherings, being very close to each other. So, we want to get back to that. We all have our own personal responsibility to assure that we're not spreading the virus. So that's a big request to all the parents that are out there too. So thank you.
Right, so really looking out for one another. We are in this together. It's been a rough ride, but we're going to get through it. And I just want to say thank you to everyone who has attended our Facebook Live discussion. Again, we're going to try to get through those comments and help provide answers to questions that we might not have touched on today. Thank you for joining us. We really appreciate your questions. And just remember, our health departments are here for you. We want to help our residents. We're in this business to care for, the health and well-being of our residents. So thanks for joining us, and stay healthy.
Thank you, everybody.
Thank you.
Have a great weekend.